But I want to start off with infection and chronic disease. And this is what Dr. Carter calls subacute, what I call chronic, same thing. And so this is part 2. And I just want to remind everybody that this isn't something that Dr. Carter and I made up. Here's the Vice President of Tuberculosis Drug Development and Vice President of Scientific Affairs at Lilly. And here she's talking about infectious causes of chronic inflammatory disease and cancer. And she's naming what I consider the usual suspects: H. pylori, mycoplasmas, chlamydia pneumoniae, things we test for. Now, in our grand scheme of things, 69,000 ICD-10 codes for diagnostics, 4 mechanisms: poor repair and recovery, bad food, bad absorption, sensitivities, bad absorption, bad gut, thrive versus survive. Are you constantly in a state of stress? Or has your body looked at a certain ailment you have, like chronic pain, and said, it's not a survival issue, so we're not going to worry about it anymore. And I do recommend you look at Dr. Carter's video on our YouTube channel about the shockwave technology. Very fascinating. And then chronic infections. And these are much more ubiquitous than you can ever imagine. And that's why I have Dr. Ewald's book, Plague Time, that I recommend you look at. We talked about this last time. Hopefully I'll get that video published this week. But, drugs, I'm not going to harp on drugs because we already talked about drugs that cause more harm than good. But just for hee-haws, some of the most hilarious but sad commercials on TV for these very expensive biological drugs. So I have a couple I'm going to play for you. The first one is on Stelara. I have no idea what it is. I don't care what it is. All I know is the drug ends in MAB, monoclonal antibody, or ILB, which is another type of monoclonal antibody. These drugs downregulate inflammation generically. And inflammation is a treasure of nature. Yeah, you can have cytokine storms and have problems related to it, but it's never at the root. There's always something at the cause. So basically, these drugs are tuning down your immune system, making you more vulnerable to other things. And on our talk about drugs that do more harm than good, we talked about how these advertisements are actually designed to desensitize us to the side effects of these drugs. So very short, hopefully you can hear it. Let me make sure my volume's all the way up. And so just a 10-second little soundbite.
May lower your ability to fight infections and may increase your risk of infections and cancer. Some serious infections require hospitalization. Before treatment, get tested for tuberculosis. Before starting Stelara, tell your doctor if you think you have an infection or have symptoms such as fever, sweats, chills, muscle aches, or cough. Always tell your doctor if you have any signs of infection, have had cancer, if you develop any new skin growths, or if anyone in your house needs or has recently received a vaccine. Alert your doctor of new or worsening problems.
Look at even tell your doctor if you've had a vaccine, because they know that's suppressing your immunity, or giving you a little infection that if your immune system's suppressed, it can get worse. But my favorite line there is, tell your doctor if you have an infection. At least 90% of infections are stealth subacute chronic infections. Your doctor has no idea how even to test for these, never mind. So you're supposed to tell your doctor? I think it's the craziest thing ever. Our FDA is a mess. So here's Humira, just as bad.
Having Humira for over 13 years.
Humira can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections and cancers, including lymphoma, have happened. As have blood, liver, and nervous system problems, serious allergic reactions, and new or worsening heart failure. Before treatment, get tested for TB. Tell your doctor if you've been to areas where certain fungal infections are common, and if you've had TB. Hepatitis B, are prone to infections, or have flu-like symptoms or sores. Don't start Humira if you have an infection.
Ready for a new chapter?
Don't take Humira if you think you have an infection. Well, let me tell you a little something. Everyone listening does. Okay? So how that translates is don't take Humira. Get to the root, solve the problem, run our infectious testing to find out for sure. Look, immunity will protect you from infection. So it's all a question of where are you on the infectious disease continuum? We all have it. When you die, you start decomposing from within. They're already there. Your immune system is at war every day, keeping them under control. What we want to measure is, are they getting out of control? I just had a gentleman last hour who has atrial fibrillation. And credit to his cardiologist, this gentleman has severe periodontal disease history, and they're treating him for it. But the cardiologist actually suggested that the AFib is due to the periodontal disease. However, part two of this is the cardiologist will not see this gentleman anymore unless he's taking his medications, blood thinners. So in our thing on drugs that do more harm than good, Xarelto. Arnold Palmer was advertising Xarelto. Arnold Palmer died on the operating table because he bled out because he was on Xarelto. So the drug that he was advertising killed him. Anyway, but I'm not going to go into this in a great deal because we've already talked about periodontal disease. So let me just tell you about this consult that I just had 1 hour ago. He feels he's getting good care from his dentist and the periodontal doctor that's working with him. And the statement they said was, it seems we have things under control. Seems. And I told him that seems is not good enough when there's testing out there you can do. So he ordered the chronic disease temperature, where we'll look at the white blood cell counts, and that'll tell us whether, and the neutrophil to lymphocyte ratio, inflammatory markers. This will let us know if we believe he has a low-grade infection and of what type, viral, bacterial. It's kind of hard to tell about things like mold and other types of infection. But we'll run the oral DNA. The oral DNA test will eliminate all doubts. And he bought into that as well. So periodontal disease is something that we don't get from our standard lab testing, but you can get that from the oral DNA test. So if you haven't had that, you have any, and so many people, you got to watch the most recent video we published I think I did it on Sunday, in fact, of this lady who gave a profound testimony about what happened when she removed one single root canal, including the graying that she was having in her hair, largely reversing, eye floaters reversing. So it's an important topic. So we're going to go a little divergent rather than just talk about organisms. We're going to talk a little bit about treatment. And Dr. Kerner and I will be updating our video on cod liver oil. But it was very profound that we had a question on cod liver oil at the beginning of this discussion, because it's something you can do on a daily basis that'll help you fight, low-grade infection in your body. It's been known for centuries to relieve pain, prevent rickets and other more severe diseases, including rheumatoid arthritis and tuberculosis. In those ads, they keep talking about TB, tuberculosis, like that's the only infection that could ever affect our health. There's so many other types of infections. And, this little chart, this is death rates from influenza. And what we see is it's really a titration of our innate and adaptive immunity. So we can see young people die from influenza at pretty high rates. They have strong innate immunity, but they have weak adaptive immunity. They haven't been exposed to the environment yet. So they don't have a lot of antibodies against a whole bunch of different pathogens. And then we can see as we age, we start losing immunity. This is when we have risk to the infections that lie within. Okay, cod liver oil helps boost immunity and protects our most vulnerable populations, our young and our old. The sad thing is today, most OBGYNs will not recommend cod liver oil to pregnant women or fish oil. which is extraordinarily important to fetal brain development. Why? Because they almost are prepared to do a C-section. And that's a major surgery. And they're concerned about bleeding. And there's some data that, cod liver oil, fish oils will enhance bleeding a little bit. There are plenty of publications that argue against that. But I think it's quite a crime that we're not doing this. But anyway, if you want bright, sociable children, you want your mom, pregnant mom, on cod liver oil, and you want the youth on cod liver oil as well. So here's the article. When you talk about dose, treating tuberculosis with cod liver oil, an 1848 study in British hospitals, these people were dying from consumption. Okay, tuberculosis so bad they're coughing blood. And what we saw was about a 200% absolute reduction in mortality using 15 to 50 grams a day. Now, 50 grams, what does that translate into pills? 50 pills a day. No one wants to do that. I recommend people with pretty serious conditions that they do around 30 grams a day for at least 3 months. And that would be 30 pill equivalents, or if we titrate it into modern culture, about a shot glass of cod liver oil at 2 tablespoons. And you can measure your omega ratios, and you can measure EPA attached to red blood cells. So these are measurements you can do, but usually in America, 3 months, you pretty much remodel all the red blood cells and pretty much all the cells in terms of having adequate EPA, DHA, the omega-3 marine fatty acids in your system. So let's look at the next one. So whole year daily use of cod liver oil was associated with low risk of death from patients with solid tumors. And in lung cancer patients, lung cancer, chlamydia pneumoniae, mycoplasma pneumonia. You don't just get lung cancer because of no reason. I won't tell you what Dr. Trump used to say to folks, but his patients loved him. He could get away with anything. But so many cancers are tied to either an infection of a bacterial or a viral nature. So cod liver oil will fight that. One of my favorite ones, and we did this at length at the beginning of the year on our set of videos on cholesterol, or really LDL, more importantly, SOAP, in our videos called How Not to Die Young. But what Harvard is saying is that statin drugs that lower LDL don't provide us with the ultimate benefit, and that is longer life. Okay, how does this relate to infection? I hope the heck I get there very shortly, but I think I will. But here's a curve here's an analysis we did of the published literature. The CDC looking at from 1900 to 2010 death rates from total cardiovascular disease. And you can see we're on a decline here. And then all of a sudden we had a little uptick in that decline. Essentially, cardiovascular mortality went up to some degree, and this is when statins were introduced. So lowering cholesterol is not the solution. So let's understand why. This is from the University of San Francisco. Some really fine work out of this medical school. The effect of inflammation and infection on lipids and lipoproteins. So it's really important to know when your lipids are up, not your cholesterol, because they're never even measuring cholesterol. When they measure your total cholesterol, it is HDL plus LDL plus your free cholesterol. No one ever tells you what your free cholesterol is, ever. I can guarantee you, you know what your LDL is, but you have no idea what your free cholesterol is. So we're really talking about LDL. The changes in lipids and lipoproteins, so HDL and LDL, that occur during inflammation and infection are part of the innate immune response, and therefore are likely to play an important role in protecting the host. That's you. So really what it's saying is, if your lipids are up, your LDL is up, the last thing you want to do is artificially lower it with a statin drug, because it's part of the innate immune response. You're fighting your own immunity when you take this drug. But really, the underlying cause of the elevation in your lipids is most likely a chronic or subacute infectious process. So here's a study on cholesterol in hospital patients with infectious disease. Total cholesterol was inversely and significantly related to urinary tract, musculoskeletal, and all infections among men, and all infections among women. So when your cholesterol goes up, you have an infectious burden. That's basically the idea. So rather than treat with a statin drug, let's find out what is causing it. Periodontal disease, another type infection, virals, cytomegalovirus, anything along that nature. Just some really off-topic things, but important for you to understand. You know, I'm not a big genomics person in terms of using them as a tool to evaluate your health. But they can be very important if you know what you're looking for. And this is a paper I read, 16 years ago. And it was really interesting. Microbe-induced epigenetic alterations in host cells, your cells. The coming era of pathoepigenetics of microbial infections. Emerging new field may have important therapeutic implications because epigenetic processes can be reverted, and elimination of microbes inducing epigenetic changes may prevent, prevent disease development. So when someone's doing epigenetic testing and they say, oh, it's your genetics, it may not be your genetics. Matter of fact, it's probably not your genetics. It's environmental factors, heavy metal toxicity, lack of nutrients. But infections can lead to, I don't want to say false positives, really real positives. What do you do if you have an epigenetic disorder? Find the cause, once again. Let's see. This is infectious agents are known to reprogram your cells to the benefit of their life cycle. And these changes can be long-lasting and global or transient and of limited breadth. So it could be either. So chlamydia pneumoniae does not require the mitochondrial source of ATP. It employs a very cunning strategy that protects the host mitochondrial architecture from the intrinsic stresses generated by the infectious process itself. What does this mean? Robert Horvitz at MIT won the Nobel Prize by studying worms and showing that cells have a pre-programmed lifespan. So like I always talk about, why is your poop brown? Because red blood cells only last about 4 months. Your kidney pops the iron out and recycles it. Then the red blood cell turns brown and you see brown poop. That's one of the reasons why your poop is brown. So there's programmed cell death. They only hang around for 4 months. Every cell lives and dies. These infections we're talking about are very difficult to measure because they get inside cells. When they get inside cells, they're hard to detect and they're hard to treat. But when they're inside the cell, they don't want to leave that internal environment. They're like, in an infrared spa or something. They're enjoying life in there. So what happens is, since they don't want the cell to die, because when the cell dies, they have to go find a new place to live. And during that transient time, they're exposed to your immune system. So they literally will extend the pre-programmed life of that cell beyond the apoptosis, beyond the programmed cell death. And instead, you have a very old, weak cell crippling along. What do you feel? Joint pain, brain fog, Alzheimer's, chronic fatigue, because the cells are not optimal. And the organism is at the root of that process. Very interesting, very interesting. And look, it's just survival. They're just trying to survive just like we are. And they're using every trick in the book to sustain their longevity. Infectogenomics Insight from the Host Genome into Infectious Disease, same thing. 5 years into the human post-genomic era, we're gaining considerable knowledge about the host pathogen interaction through host genomes. This infectogenomics approach should yield further insight into both diagnostic and therapeutic advances, as well as normal cellular function. So, of course, this is published by a bunch of researchers, and all they really say at the end of this article is we need more funding to do more studies. But we know the organism is affecting your health, from AFib to chronic pain, whatever Lyme causes, amplify that, glaucoma, Alzheimer's, so many different things. So we can take action today to resolve these problems if and to what extent there's an infectious component. And of course, how do you know if you've been vulnerable? And that's why I showed that curve on the mortality rate from influenza. When you're young, you're susceptible. When you're older, you're susceptible. Or in my case, I had AFib from Lyme disease. I had a high stress environment. I got acutely sick, and I was overtraining for an Ironman. Perfect storm of vulnerability. So it doesn't take a lifetime of vulnerability. There are certain stressors that can make you vulnerable enough that those from within or even new ones from without can potentially take hold, gain a foothold in your body, and start creating stress, start creating inflammation, start creating energy deficits in the most basic structure within your cell, mitochondria, which we talked about a bit last time. And pardon me as I'm trying to reach down my slide deck here. Cell death in the host response to infection. A wide variety of microorganisms have evolved mechanisms to modulate host cell death and to use a step in cell death to their advantage. So I'm repeating more of the same. Now I'm going to go over a couple of case studies very quickly. So this is on our website under testimonials. You click on that button and there's some testimonials and case studies. They're probably not the easiest things to watch. They're a running slideshow, so without narration, but here's a couple of key points. Here's a lady, raw data here, who at the age of 41 had been taking medications for daily migraines since she was 18. Okay, 18. So let's titrate. 23 years. And what we did, we were allowed to run very detailed infectious testing on her. And we had very high HSV virus, Toxoplasma gondii, parasitic infection, chlamydia pneumoniae, the intracellular parasite that comes into the lungs, but really lives inside the cell lining of any or all vessels. Okay, let's see what else we had. Okay, she was reactive on the Western blot for Lyme disease, had a small amount of Mycoplasma pneumoniae. And I don't really give the endpoint, but we treated her for 3 months. I would have treated her longer, but we were in a corporate program. We were only given latitude to treat for 3 months. She was on 4 different medications, high dose Excedrin, beta blockers every day. I can't remember the other 2 drugs that she was on, but we alleviated her migraines and got her off the beta blockers for the first time in 20 years. So a migraine is simply an energy crisis in the brain, in my opinion. A headache, same thing. That's why beta blockers work, get a little dilation. But the point is, the energy in her brain cells were being robbed by intracellular pathogens of a variety of ilk. We get so many people that made life changes, had an epiphany, changed their diet, are exercising, can't lose weight, can't seem to get over chronic fatigue, joint pain, whatever. So here's a lady, anxiety, depression, lack of rest, pain somewhere, stomach issues, lack of energy, ear, nose, and throat issues. she had a wedding coming up in 9 months, and she asked us to sort of help her lose weight. It's like, well, we're going to help you get healthy. We'll worry about the weight later. But, you know, she had 36 diagnostic codes assigned to her, and she was under pretty heavy pharmaceutical management. And that was it. And what we showed her, one lousy band for Lyme. But I can tell you, if you have one band for Lyme, based on how imprecise this testing is, you're Lyme positive. HSV, Q fever, very interesting rickettsial disease. Both, let's see, was it both positive and the chronic phase? And we're still working with her today. We're no longer at that corporation, but we're working with her directly. And she has a great testimonial on our website over how profoundly her health changed. We pre-treated her for 3 to 6 months, which means we helped optimize diet and other risk factors. But it wasn't until we treated the infectious condition that she really started, her health really started reemerging in a very positive way. And I think a lot of you have followed me and Dr. Carter, have seen this case where this gentleman, as a machinist, was having a hard time bending his hands any longer. Even though he was sort of a natural guy, raised honeybees and all that, was diabetic, overweight, and with really severe rheumatoid arthritis. And so this is what we saw: frequent memory problems, gums bleeding, tick bites, chronic pain, rheumatoid arthritis. He said that he was on a scale of 0 to 10, 10 being worst pain, between 6 and 8 every day of his life. Catches cold a lot, gets a flu. So he had this organism, chlamydia pneumoniae, among other things. And do I even have the pictures? Well, we don't have the pictures, but go out on the testimonial. But we essentially completely reversed his RA. He could move his hands again. The swelling had come down substantially. He's no longer diabetic, lost 25 pounds, and basically was a happy camper. Just another sort of different point. When you get the flu, you're sick because of detoxification from the die-off of the flu bug when your immune system finally catches on to it and kills the flu. But when we treat these chronic subacute infections, you can have flu-like symptoms, and they can vary as widely, much more widely than the flu, where you sort of have whole body fatigue. I'm working with a couple of people right now. One's having more brain fog. That gentleman had some memory issues. This is where the infection is, in the brain. And when you treat it, you get the release of endotoxin or lipopolysaccharide. It creates, and your immune system responds with inflammatory cytokines. So it's no different than kind of having a flu symptoms. You get flu-like symptoms, achiness, headache, mental fog, skin rashes, loose stool, fatigue, fever, sweating, chills. Generally, this will occur systemically, but it'll also occur profoundly where the infection is localized. And this gentleman was our worst case, whereas he had whole body flu-like symptoms for 3 months. And we did a lot of dose, treatment modulation, detoxification, dose modification to control those symptoms, so he wasn't in more misery than he was just from the rheumatoid arthritis. And this is somewhat of a controllable thing. So, but it is a real thing. And then here's Thomas Insel. He's retired from the National Institute for Mental Health as a director. And what he says is many mental illnesses are linked to infectious agents, dating back for at least 100 years, but really it's much further than that. Germ theory, Louis Pasteur. But what he also says in this blog is that we probably only know a small percentage of the organisms. Now, what we test for is what we say are the usual suspects. If you're vulnerable, it's unlikely you're going to have just one organism. You know, the oral DNA test tests for 11 different organisms, not just one. So usually if Mycoplasma pneumoniae is up, chlamydia pneumoniae is up, some other organisms, you probably have more than just those. It's probably a constellation. They're all opportunistic. Whatever's there, whatever you've been exposed to, whatever's waiting in hiding, will take advantage of the situation. Let's see, 2 more slides. So here's I haven't published this yet because I'm not a researcher. You know, I compile data and I use data from our clinical work. And I've compiled all the data from about 285 people that we've worked with, and then several hundred people that Dr. Tremp worked with. And so you can find this paper on our website under books. And I call it occult, not easily found. Cryptic means when you got exposed may not be when you get symptoms. The symptoms can occur years or decades later, so you have a hard time creating the association. Chronic infection is a substantial contributor to chronic diseases. And I just have this out here as the heading to it, but I wrote an extremely long introduction because a lot of people have questions about this, and it's hard to find really good answers in one place. I think Dr. Ewald's book is good. Dr. Casal's paper is really good. But what I really try to do is distill this whole topic, particularly with regard to the testing. There's a lot of controversy about the testing we do. We just do so-called past or chronic phase testing. But what I show in this paper is that if you're IgG positive, they're there. They can be active or they can be dormant, but they're there waiting for an opportunity. It doesn't mean you don't have them. That's the important point. So we will do part 3 next week, where I'm probably going to do it a different way around. What we're going to do is look at various conditions and show you what the research says as to what organisms can potentially be having an impact, exacerbating or causing those various conditions. And so with that, we have a slew of questions. Michael, do you want to talk about your glaucoma and how it related to the subacute infections that we found?
Oh, sure. Yeah. So definitely that was one of the, hurdles that I personally had to deal with. So finding, high titers of Epstein-Barr virus, mycoplasma, chlamydia pneumoniae. I can't remember if I had Lyme titers or not. I mean, it wasn't overt, but definitely mycoplasma, chlamydia pneumoniae, and Epstein-Barr virus were high on the list. So again, driving that subacute infection and driving that inflammatory process is, something that, of course, is totally overlooked by, well, pretty much all traditional doctors, but especially, ophthalmologists who wouldn't even consider, other than Dr. Tremp, drawing blood and making that connection. So, the whole universe of individuals with, eye diseases, that is completely missed as one of the driving forces.
Michael, I think it's important to state too, that when I met you, you were an extremely healthy individual. You had no fatigue,
all right,
no other problems. So you were classic in terms of having truly focal infection, localized infection just in your rectum.
Correct.
Yep.
Absolutely.
What is the truth about krill oil as compared to cod liver oil? Michael, you want to address that?
Krill oil, is more of a, let's say, I know Dr. McCullough really likes the krill oil because of the more lipid solubility with the phosphatidylcholine content in it. So I think it's absolutely beneficial. But, just with the cod liver oil, itself, just, like Tom was saying, over the years, it is shown how efficacious it is for a whole host of things, and if it can knock out TB, way back when, you need to really, understand the power of it, adding it to the regimen that we suggest for you.
And, it's very convenient.
Tom?
They come up with one sec, Richard. They come up with a 1 gram pill. And then they do the study in the Framingham Heart Study and show no benefit.
Right, exactly.
Everything's this kind of curve. You got to get on this end of the curve. So you got to do at least 5 grams a day, preferably 15 grams a day.
Right, absolutely.
Go ahead, Richard.
2 comments. One is that on cod liver oil, I have found that to be very helpful in regards to my dogs in keeping their weight down. Okay.
Yeah.
I had one dog that lost 20 pounds only on the cod liver oil addition. And considering the fact that we have a lot of overweight dogs, just a comment for people to think about. And a very interesting movie in regards to mental illness, which is on Netflix, is Brain on Fire. And if people get Netflix, if you see the movie Brain on Fire, it will really speak to the fact of infection and mental disease.
Cool. Awesome.
Yeah. The other comment on the cod liver oil is, I don't have any problem with doing krill oil, but cod liver oil has the fats, more of the fat soluble vitamins. And I think that's what makes it anti-infective.
Yeah.
Green pastures. So we have a lady that did a very, very bravely, occupational therapist, very brave testimony. It's out on our YouTube channel. Go to healthyvitalpartners.com. On the header, just click on the YouTube button. And she talked about how she's convinced she was spared from having a stroke by taking high dose cod liver oil. And she was taking green pastures. So I'm now rotating. I'll do Garden of Life. I'll do Nordic Naturals. I'll do Carlson's. And now I'm doing green pastures. What's really interesting about it is they give you a little syringe. And I got the cinnamon version.
That's the best flavor.
You fill up the syringe and you just shoot to the back of your throat. And then I chase it with a little piece of grapefruit, and that's it.
Yeah.
Please say again what the headache means. It's an energy crisis. When neurons are dying, it's an energy crisis in those cells. So it's like they are literally being robbed of their energy. So how does the proper health of our gut improve our chances for overcoming the focal infection? Michael, you take on that one.
Oh, well, remember 70 to 80% of your immune system is located in your gut. So, and it has to be that way. Just kind of think about it. You are drinking and potentially contaminated things. You're eating potentially contaminated foods, and there are critters in everything. So you have to have a strong constitution, in that arena to protect you. So that is the, the frontline forces. So you want to make sure that is bolstered as much as possible. But, because of, all of the toxins that we're exposed to, the medications that cause, leaky gut syndrome or hyperpermeability syndrome and so forth. And, the gluten and the dairy of today that is decreasing that capability, and also the, H. pylori that's decreasing the, hydrochloric acid and so forth. All of these things combine to really overall decrease the strength of the immune system in the gut. So that's really, really important.
Right. I mean, and if you're going to be treated, whatever the treatment is, natural, pharmaceutical, energy medicine, whatever, you want to have all your systems optimized before you go on a journey of treatment. So I think that's really important. Linda says, controversy about green pastures. That was a long time ago, being rancid.
Yeah, that was proven not to be correct. Yeah, that was quite a while ago. They did some pretty extensive studies to show that it was actually okay.
Yeah, believe me, if it was rancid, you would know.
Yeah, and it's been around forever.
Yep. Any other questions? Otherwise, we're done in record time. All righty. We will see you next week with part 3 in the series. Have a great day. Have a great week.